This is going to be controversial, I understand it. This is just my belief, and again, this isn't medical advice. But if you look at this right here, this is basically a chart I made maybe a year ago at this point, and I'm resurrecting it for this video. This is basically how your body increases blood pressure. The liver produces angiotensinogen, renin from the kidneys turns it into angiotensin 1, ACE, it's actually all over your body, but a lot of it's produced in the lungs, converts angiotensin 1 into angiotensin 2, and now we actually have wheels on this thing. This is where the blood pressure starts to get manipulated. Angiotensin 2 can increase vasoconstriction, basically to make it simple, your blood vessels stiffer, so now there's more pressure when the blood goes through it, and it increases aldosterone production, which will increase water retention and also increase blood pressure. Now, increasing blood pressure in and of itself isn't bad, right? You want your body to not have it too low, you don't want it to have it too high, it needs to be tightly regulated. Now, if it goes way too high, you're in some trouble. And based off of my research, some of this is in mammal models like mice, some of this is a little bit of speculation, but this is how I believe testosterone can influence this actual tightly regulated system. It can increase renin expression, ACE expression, and aldosterone. Now, these things, as you can see from the chart, can increase blood pressure. I understand this is controversial, but I can say as somebody that owns a TRT clinic, we have a ton of guys that are patients here. We help a ton of men. There is a small amount of guys, not a large, but there is a non-trivial amount of dudes that start to see an increase in blood pressure when they start TRT. Now, do we just drop them off TRT? Maybe some guys will. I'm not the doctor, it's up to them. But I can say that there's so many benefits to testosterone replacement therapy. We'd rather manage this and continue TRT for the right guy, again, this isn't medical advice, than just cut therapy altogether. That's where Telmisartan comes in. I believe in Telmisartan so much, I take it every single night. We're gonna go over that medication now that we've set the frame right now in part 2. What is Telmisartan?